Welcome to Fast and Furious MCQ edition. Let's discuss about the hepatitis in topic of virology and the MCQs as in the hepatitis topic. The hepatitis virus, we have hepatitis A, B, C, D and E. Let's see each of this. Hepatitis A is the most common cause of acute hepatitis in children. This can be remembered with the word mnemonic, a child. Here A stands for hepatitis A and the child is to remember that hepatitis A is the most common cause of acute hepatitis in children. Next, hepatitis B. B behaves like a big brother, that is, whatever happens to it, it's because of hepatitis B, and it's the main cause for most of the hepatitis related diseases. For example, hepatitis B virus is the most common cause of viral hepatitis, and hepatitis B virus is the most common cause of viral hepatitis during pregnancy. During pregnancy, hepatitis B virus is the most common cause, and most common cause of chronic hepatitis is hepatitis B virus with the maximum prevalence. Prevalence means number of persons living with the disease. So that is highest is for hepatitis B virus, and carrier state is most common for hepatitis B virus, and most common cause of acute liver failure in India is due to hepatitis B virus, and it's an oncogenic virus, that is, it leads to carcinoma. Hepatitis B virus is the most common cause of hepatocellular carcinoma. Next, moving on to the hepatitis C virus. This C stands for chronicity. The maximum risk or the maximum potential to change acute to the chronic form is with the hepatitis C virus, whereas the most common cause of chronic hepatitis is hepatitis B, but the maximum potential or the risk factor to change into chronicity is with hepatitis C virus, and C also stands for the cirrhosis of liver, most common cause of cirrhosis of liver. Next, D virus. Hepatitis D is have the maximum risk to change to fulminant hepatitis, whereas hepatitis E is the most common cause of fulminant hepatitis. This can be remembered with alphabetical order A, B, C, D, E, F. Here hepatitis D have the risk to form the fulminant hepatitis, but E is near to the F, so E is the most common cause for fulminant hepatitis. And hepatitis E is the most common cause of acute hepatitis in adult, whereas acute hepatitis in children is due to hepatitis A, whereas acute hepatitis in adult is due to hepatitis E, and the most common mortality in pregnancy is due to hepatitis E virus. The most common viral hepatitis during pregnancy is B, but the mortality is higher with hepatitis E, and acute liver failure in India is due to hepatitis E. We have two forms in acute liver failure in India, hepatitis B and E virus, and hepatitis E is the most common cause of fulminant hepatitis. The other causes of cirrhosis of liver are alcohol is the main cause of cirrhosis of liver, and in the Western countries, acute liver failure is due to paracetamol poisoning. Paracetamol poisoning is the most common cause of acute liver failure in Western countries. Among these, hepatitis A, B, C, D and E, B is the only DNA virus, and remaining all are RNA virus. Hepatitis B is also called the HepaDNA virus. In the name itself, we have the DNA. So, hepatitis B alone is the DNA virus, and remaining all are RNA virus. Regarding the mode of transmission, hepatitis A and E have the fecal-oral route, whereas hepatitis B, C and D have the blood transmission or needle transmission or via the vertical route from mother to fetus. This can be remembered, that is, vowel letters A, E, I, A and E or the vowel, we have the fecal-oral route, fecal-oral transmission, whereas hepatitis B, C and D have the blood transmission, vertical transmission or needle transmission or through blood products.